Yes, sir.
Okay,
Yes.
super. Okay, so everyone is connected. Shubham, Hitesh, Kurma, and then Monica, Mala, Meena, and Priya, Richa, and Tamil Selvan. Okay, super. Okay, guys, so we are done almost everything. So today we have to discuss HIPIX and ICD. So this weekend, right? So either Saturday or Sunday, I have to give you the timing. So we have to discuss the E&M, guys, right? So actually, why I'm not confirmed still the timing mean actually the Ramzan is going, so we are in fasting. So which time is suitable? So like that I have to check. So once I am get confirmed, maximum within this week I have to update in your group, guys. So please connect accordingly. So my only thing is you guys please try to everyone is connect because it's a very important one. E&M. It's not only for exam in your coding also it's very important and mainly it will take maximum 1.5 hour or 1 hour 45 minutes like that. So within that we have to complete. Actually, we are planning in weekdays. Mean it is not possible because the E&M is a same lineup. If part by part, if I am discussing, mean you guys will not understand anything. So continuously, if you guys attend, then only you have to understand the concept. That's the reason for all the batches, not only you. For all the batches, we have to schedule the E&M in weekend. Then only they will understand very easily. Okay. So today we have to discuss ICD and HIPIX, guys. So I think in this week this is the last session. If we completed this, only the E&M is pending. That's all, everyone. And one more thing I want to discuss. Actually, in your CPC exam, you guys having one more topic is called as complaints, guys. Right? So we are receiving 3 questions from that, but the complaints is not a guideline or concept or coding. Nothing. Complaints mean it's a rules and regulation. I hope you guys remember the HIPAA, OIG, Medicare, like that. So some of the billing related question. So tomorrow I have to share one recording for that. So why we are sending recording? If one time if you guys attend the complaints mean you guys will not understand anything because everything is a theoretical content, rules and regulation. So you guys please download that video and you have to saved in your mobile. Please don't delete. Once you guys complete your exam, then you will delete, no issue. Because whenever you guys have forgot the guideline, you guys will go through that mean it will be good for this complaints alone. Like so what is the ABN, what is OAG, what is HIPAA, like that some of the theoretical thing we are discussing. So please go through that before your exam also. Whenever you free one more time go through that, definitely it will be helpful for your exam. And mainly the complaints question before your exam we have to share the question, right? So the recent exam question we will share. If you guys prepare that, that is enough. So we are receiving the question from that, but just for the knowledge. Okay, so today we have to discuss 2 books, guys. One is the HIPIX and ICD. So first we discuss HIPIX. So HIPIX, in starting I'm already informed. You guys no need to put any effort for HIPIX, right? Whenever we are given the introduction, that time I'm already informed. For this HIPIX alone, you guys nothing will do. Just see the question and you have to code accordingly. That's all. You guys don't have any guideline or concept. Nothing is there. One thing you guys will do. Maximum after this session, I will share the questions for HIPIX also. In this week, if you have free time, you will complete the HIPIX assessment. Then you guys will know how much easy the HIPIX. I think in that question, you guys having 35-40 question. The candidates will complete within 15 to 20 minutes all the question. So that much easy the HIPIX because you guys no need to prepare anything. Just whatever the question they given, you check the question and the same question they given as the option. So that is a HIPIX. Clear? Okay. Actually, the HIPIX is not needed the session, but for your knowledge purpose, I have to discuss, guys, right? But please don't mug up anything. Whatever we are discussing, just to try to understand. No need to mug up or prepare anything. Okay, so please note down, guys, the HIPIX. HIPIX mean Healthcare Common Procedural Coding System. This is mainly for non-physician service such as ambulance and prosthetic device. So please note down this slide and update me, guys. And please note down, we are receiving 3 questions in your exam from HIPIX. Once you guys complete it, please update me. Once you guys complete it, please update me, guys.
Completed, sir.
Okay. Okay, guys. So one thing, guys, still now we are discussing CPT, ICD, right? So this 2 books is a provider oriented building. Actually, whatever the code you are given, the code will directly go to the provider. But the HIPIX mean it is directly going for hospital. So that's why here they mention non-physician service, right? In hospital, the provider using ambulance or any wheelchair or any syringe needle, whatever in hospital they are using, all those we have to build in this particular HIPIX only. So that's the reason in coding companies also the HIPIX mean very rare the codes they are using. Overall the coding the 5% they are using. In coding also the HIPIX we are not using frequently because it's not a provider building. That's why. Okay. So now I will discuss some of the alphabets, guys, right? So the I'm already given the HIPIX codes are alpha numerical code. So some of the important thing I will discuss, but please don't mug up, guys. This is just for your knowledge. So for example, the A code. So A code mean what all the things will come mean if the provider using any transportation, equipment, supplies, all these thing will comes under A code, guys. Right? So please note down. If the provider using any wheelchair or any bed, anything from hospital, you have to use this one. So please note down this, guys. Once you guys done, please update, guys.
Completed, sir.
Okay, right? Yes. So this is for A code. So A code mean the transportation. So everything we have to give. So the next is the G code. Actually, because of G code only, I have to schedule this HIPPIS, guys, right? So in this G code, we have the concept. So first I will discuss, guys. Then you guys please note down. Actually, in HIPPIS, the G code mean it is a procedure and professional service, right? So mainly in this G code, we have one concept, guys. I hope you guys everyone remember the colonoscopy, right? So colonoscopy in US actually what happened mean 10 to 15 years before, right? So 10 to 15 years before, the patient, whatever the problem, if the patient having vomiting or diarrhea or abdomen pain, if the small symptom also, the patient directly go to hospital and they are going for the colonoscopy. Because the reason, the 10 to 15 years before, the colonoscopy is a free for everyone. So everyone they go for free colonoscopy. So after that, the Medicare will planning one thing. I hope you guys know what is Medicare, right? Medicare mean it's a one of the federal insurance in US, right? It's a government insurance. So the Medicare, what they are planning mean they have to plan one thing. So they have to split the patient into two type. One is the high risk patient, another one is the non high risk patient. Clear? One is the high risk patient, another one is the non high risk patient. So the patient who are all comes under history of colon polyp, family history of colon polyp, family history of colon cancer. In these three condition, if any condition the patient have and coming for colonoscopy mean they are considered as a high risk patient. Other than these three condition, remaining all the condition like abdomen pain, vomiting, diarrhea, like all the condition, they consider as a non high risk patient. So whenever you have to quote, the patient comes under high risk mean that time the insurance will pay for the service. If the patient comes under non high risk mean that time the patient have to pay by own. So this is the guideline. So overall the HIPIX book we have to follow this guideline, guys. So please note down, then update me code set also. So please note down, guys. So if you guys completed this slide, please update. We have the next slide also. Okay, so you guys completed. So please note down this continuation, guys. So we have two code, guys. One is for high risk and another one is for non-high risk. Right? Okay, you guys tell me. In your question, the provider documented the patient have history of colon polyp and MD perform colonoscopy. So this is high risk or non-high risk, guys?
Non-high risk.
Okay, the patient is history of colon polyp. The history of colon polyp we consider as a high risk, guys. Right? So three condition, guys: history of colon polyp, family history of colon polyp, family history of colon cancer. In these three, any one condition the patient have, you consider as a high risk. If other than these three, anything the provider document, you go for the non-high risk. Okay, you guys tell me, if the provider documented the patient having abdomen pain, so can we consider high risk or non-high risk, guys?
Non-high risk.
Yes, it's a non-high risk. You guys clear? So this is the concept. Okay, so next one is the J code, L code, and R code, guys. Right? So J code mean drug code. So the provider documented any drugs mean the code will comes under J code. And then L code mean orthopedic procedures, right? So the provider using any plate, screw like that orthopedic device mean it comes under L code. And R code mean radiological code, right? In radiological device, anything the provider using, those code will comes under R code. That's all, guys. Please note down this.
मुझे ये चीज़ पता चल गई कि हमें यहाँ एडिशनल इन्फॉर्मेशन देने होती है ना तभी हमारे वर्किंग को टेस्ट करता है क्योंकि यहाँ पर देख वो नहीं लिया इसने ये कहा गया मैंने बस ये लिखा और ये लिखा यहाँ पर देख वो नहीं लिखा इसने वो क्या कहते हैं ये डिविडेंड डिविडेंड क्यों लिखा क्योंकि वहाँ पर एडिशनल इन्फॉर्मेशन में दिया है शायद इसमें है डिविडेंड जब जो चीज़ अभी पता चल जाएगा और 4-5 क्वेश्चन कर लेंगे तो
So once you guys completed this, please update me.
यहाँ पर लिख ले क्या ओपनिंग का अमाउंट क्या ओपनिंग में करें तो क्लोजिंग में करें यहाँ पर क्या आता है वर्किंग कैपिटल
Okay. So I hope you guys are done, right? So in your exam, I'm already informed 3 question you receiving, guys. So compulsory in the 3 question, G code you guys are received and J code you guys are receiving, drug code, right? And one more thing, please note down, whenever you have to use the drug code, please check the milligram, guys, mg, right? Please check the mg because the code will differ based on the mg only. So if you check your code mean 10 mg, 40 mg, 50 mg, like that the drug they given. So whatever the mg they given, you have to code accordingly. So you have to check that one also, right? That's all, guys. So you guys are receiving 3 question in your exam from HIPIX. From the 3 question in this G code, L code and J code. So like that we are receiving. And mainly the HIPIX, you guys no need to spend any time and no need to prepare anything. We don't have anything. Just whenever you go for the exam, before that, in that particular G code concept alone, you guys will prepare. And mainly today after this session, I have to share the question. Once you guys are doing that HIPIX assessment, you guys will know how much easy the HIPIX and everything. Clear? That's all about HIPIX, guys. So now the assessment you guys will complete next directly in your mock only. So before that, the HIPIX you guys no need to prepare anything because we don't have. That's the reason. Okay, the next please note down the ICD, guys. So next you guys please note down the ICD. So ICD we are receiving 5 question in your exam. We are receiving 5 question in your exam. Actually, this is a very big disadvantage because many candidates they have to feel because ICD is the very easiest one. Daily, whatever you guys are using in your coding, the same only will reflect it. So till 2022, what happened mean 2022, we are receiving 10 questions from ICD. But from the new, whenever the 150 to 100 question will be changed, that time we are receiving only 5 question in your exam. So you guys please note down the heading is ICD 10 and we are receiving 5 question in your exam. In this 5 question, 2 or 3 question, the guideline oriented, like whatever the guideline we are receiving today, from this guideline you guys are receiving, and the remaining 2 question, it's a direct leading, guys, right? So the lumbar stenosis, nausea, vomiting, like that, the simple question only nowadays we are receiving. The AAPC will not give more important for the ICD. So if you guys attend, you guys are getting answer. So the ICD, the introduction, right? For example, we already discussed ICD mean we have only the diagnosis, right? So it's a diagnosed based one. So in this ICD, we have minimum 3 code, maximum 7 code. For example, what is the code for hypertension, guys? Anyone? What is the code for hypertension? I10. Yeah, this is a minimal 3 code. I10, I10. This is a minimum 3 character. So maximum 7 character mean, for example, S72.1 XXA. So this is a 7 character. So mainly the 7th character in this ICD, it is based on the encounter, right? The 7th character, it will based on the encounter. So I hope you guys know we have ADS, 3 digit, right? So what is A stands for, guys?
Initial
It's
visit.
a initial encounter. And what is D stands for? So D stands for subsequent encounter. And what is S stands for?
अभी देखते हैं यहाँ चीज में देखते हैं क्योंकि यहाँ पर जो करंट अफेयर्स कर लग रही थी को तो अलग कर रहा था इसने जो
S mean?
Sequela.
Anyone? Yes, it's a sequel, right? So the 7th character based on the encounter, it will be differ. Mainly the 7th character we are not receiving in all the chapter, guys. Only the fracture and OB we are receiving, right? Mainly the fracture series, the 7th character will comes based on the encounter. And delivery codes mean the 7th character we have to give based on the number of trimester, first trimester, second trimester, third trimester, like that it will come. That's all. So this is a normal thing. And one more thing, whatever the condition the product documented, we have to bill. And in this ICD, we have exclude 1, exclude 2, right? I hope you guys will remember. You guys, anyone having idea? So what is exclude 1? What is exclude 2, guys, in ICD? Okay, so exclude 1 mean we don't code together. Exclude 2 mean we coded together. You guys clear? So exclude 1 mean we don't code together. For example, in your scenario, right, you are receiving one chart. In the chart, the product documented the patient having migraine and also patient having headache. So for example, migraine code is G43909. For example, if you check that G43909, below that in exclude 1, if the product documented headache mean, you guys don't code headache together, because exclude 1 mean we don't code with the primary code. In case the patient having migraine and also patient having stomach cancer. Now in migraine code below that in exclude 2 they mention stomach cancer mean we coded both. So very simple term, exclude 1 mean don't code together, exclude 2 mean coded together. So these are all just intro, guys, right? So in exam point these are all will not come, just for the idea I have to discuss. Okay, in your exam we are receiving the guidelines, right? Some of the guidelines. So we have only 5 question. In that 5 question, 2 or 3 question direct leading. The just a guideline oriented mean you guys are receiving 2 or 3 questions. That is enough. So we discuss one by one. So first guideline is HIV guideline, guys. Guys, everyone please note down this and update me. Then we discuss. Okay, guys. So I hope you guys are completed. So first topic we are discussing HIV. I hope you guys remember. You guys, whenever you are the fresher, if you go with any company in OJT training, the first concept they have to discuss this HIV only, right? Because it's very important guideline from the client end as well as the coding end. So HIV mean you guys know, right? It's one of the immunovirus, and mainly if HIV is documented, you have to use the code B20. So in this HIV, we have 3 guidelines, guys. Actually, the company, maximum company, they are following one guideline only. But in this HIV, in exam point, you guys will follow 3 guidelines. The first guideline is if the patient having HIV related condition. For example, the patient having one problem, the problem is because of HIV. In that time, what we do? For example, the patient having pneumonia, the pneumonia is due to HIV. In this situation, you code HIV code as the primary, then secondary you have to use the pneumonia. You guys clear? Again I repeat, guys. If HIV causes any condition, please code HIV is first, then the condition you give second. This is the first guideline. So this guideline you guys everyone follow normally. The next one is HIV unrelated condition. For example, one patient having fracture and also patient having HIV. In this scenario, you have to code fracture first, then secondary you give HIV. What does the reason mean? The HIV will not causing fracture. Maybe the fracture patient having HIV. So this is the unrelated condition. So in this scenario, you code fracture first, then HIV second. This is the second guideline. And third guideline is asymptomatic HIV. So you guys please note down additionally asymptomatic HIV or 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 Asymptomatic HIV or positive HIV. Positive HIV. If the provider documented positive HIV or asymptomatic HIV, you have to use Z21. That's all, guys. So 3 guidelines. So HIV related condition, HIV unrelated condition, and then asymptomatic HIV. Okay. So now I will give you the exam question, guys. Please note down. Exam question. Right. Recently this question receiving, guys. Please note down the question is, the patient have HIV. The patient have HIV. The patient have HIV coming for coming for chemotherapy encounter. The patient having HIV coming for chemotherapy. Coming for chemotherapy. Now the answer, please note down, guys. The answer is it 51.11? Is it 51.11? So is it 51.11 comma B20? So this is the question recently we are receiving exam. So if the provider documented the patient having HIV coming for chemotherapy encounter mean first code the chemotherapy encounter code, then B20 you are given. That's all, guys. So this is for HIV. Right? You guys are receiving one question from this. And next one is the sepsis, guys. So please note down this slide and update me. So once you guys complete, please update.
Completed, sir.
Okay, guys. So we know the sepsis mean it's a blood infection. So in these sepsis also we have some guidelines, guys. The first one, if the provider documented sepsis, right? I am performing sepsis alone mean you give the code A41.9. This is normal one. And the next one is If the provider documented the patient having severe sepsis, now you guys code A41.9 first, then R65.20 second you give. Guys, clear? If severe sepsis alone they document mean, without documented, you first quote sepsis, then secondary you have to quote severe sepsis. Right? This is second guideline. And third guideline is the provider documented the patient having sepsis. Because of sepsis, the patient getting organ failure. Guys, the sepsis is a blood infection, but it's not like normal one. If whenever the sepsis enter into the human, the next stage it will go for severe sepsis. After severe sepsis, the patient getting organ failure. So after that, sometimes the patient will die. So you guys, most of them know that. So that's why this type of guideline. Once again, I repeat, the first guideline, if the product documented only sepsis mean, you give A41.9. That's all. The second one, if the product documented only severe sepsis mean, primarily you code sepsis code, then you have to use the severe sepsis code. Then third guideline, the product documented the patient having sepsis. Due to sepsis, organ failure is given. So now what you do mean, three code you are given. First sepsis code, then severe sepsis code, then organ failure code. Right? So what does the guideline here mean? Without documented severe sepsis also, you have to use severe sepsis as a secondary code. Because if the patient getting organ failure mean, without severe sepsis will not happen. So that's why we need to follow this guideline. Guys, clear? So this is a sepsis guideline. Only sepsis mean A41.9. Only severe sepsis mean two code you give. Sepsis code, severe sepsis code. And then if the provider documented sepsis along with organ failure mean, you give three code. And then the R65.21 when we are using mean, this is for septic shock. Sometime very rarely the provider documented the patient having sepsis because of that septic shock, like that they mention. So septic shock is documented. That time you have to use the code R65.21. That's all. Clear? So first we are discussing HIV and then we are discussing the sepsis. And the next one is the combination code. Guys, combination code, you guys daily whatever you have to use same thing, guys. So here I am given 5 questions. You guys, everyone please note down that after getting free time, you guys send the answer for this question in your WhatsApp. So from combination, you guys are receiving 2 questions. So please note down this. And then after getting the answer, send me the answer for this. This is a homework question. So what is HTN, guys?
Hypertension.
Anyone?
Hypertension.
Yes, it's a hypertension. Okay, what is CKD?
Chronic kidney disease.
Chronic
Yes,
kidney.
superb. And then what is ESRD?
And stage renal disease.
Okay, super. And what is DM, guys?
Diabetes.
Diabetes mellitus.
That's all. Right? Okay, please note down this 5 question, guys. So whatever you guys are following in your coding, you guys please send the answer for that. So you guys, everyone is using, but some candidate they are following different sequence order. So that's why So after the session, you guys check the answer and send me the answer for this. Then if wrong, I will give you the correct one.
Completed, sir.
Okay, right? That's all. So you guys are receiving one or two questions from in this particular combination code, right? And then the last one is the burns, guys. So burns mean most of the candidates they don't like actually, because burns mean so they feel it is difficult like that. But I will teach you this guideline with easy manner, guys. So first you guys know what are the stages we have. So the burn having 3 degree, guys. First degree, second degree, third degree. So first degree mean the burn involving subcutaneous level problem, which means the skin level involvement. And then second degree burn mean it will involve muscle level. And then third degree mean it will affect till bone level. So this is the level. So always remember, whenever you guys are receiving burns question in your exam, please check the highest order level. If the product documented first degree, second degree, third degree mean you code third degree is the first sequence order, second degree is second, and first degree is the third order. You have to code always high level. Then after given the 3 code, the fourth code we are using TBSA, guys. So with the use of this TBSA only, I will teach you one easiest guideline. So TBSA mean total body surface area, guys, right? So TBSA mean total body surface area. So what is this TBSA mean? Calculation of first, second, third. All these three is called as TBSA. So I'm given one example here. You guys see the screen. In case you are receiving the question, in that question the provider documented first degree 10%, second degree 20%, and third degree 10%. Totally 40%. So now the TBSA code commonly it starts with T31. So T31 is the normal. The fourth and fifth digit you need to apply the concept. Guys, clearly focus. It is very easiest one, guys. So that T31 is the common. The fourth and fifth digit is the guideline. So you have to concept apply. So very simple. You guys see the screen. The fourth digit you have to pick from TBSA first character. So TBSA 40%, right? The first character is 4. And the TBSA fifth digit you have to pick from third degree first character. So third degree 10. So first character 1. So 4-1. So you guys see T3141. I will show you in ICD book. See T3141. What is the answer? See, they clearly given burn involving 40 to 49% of TBSA with 10 to 19 of third degree. That's all answer, guys. Within a second, you are given the answer. Once again, I repeat, guys, it's very simple. The product document first degree, second degree, third degree, all the percentage. So overall total is called as TBSA. So the TBSA first 3 digit is T31. It is common. The fourth and fifth character you need to apply the concept. The fourth character you have to pick from TBSA first digit 4. And then fifth character, third degree, first digit 1. So T3141. That's all answer. So if you guys apply this trick, within a minute you guys are given answer. Okay. Now I will give one question. Now lively you guys will check and give me the answer for that. So then you guys will remember, right? So please note down, guys. The question is first degree 20 percentage, first degree 20 percentage, and then second degree 20 percentage, and third degree 20 percentage. So first degree 20, second degree 20, third degree 20, and TBSA 60 percentage. Now you guys tell me what is the answer for this.
T31.6.
That's all. T31.62. That's all, guys. So nothing you guys will do. So directly you have to code accordingly. That's all. So this is called as TBSA. If you guys apply this concept, within a minute we are getting the answer. Clear? That's all. So T31 6. Why 6 mean? The TBSA 60 percentage. So first digit 6 and third degree 20. So first digit 2. So 62. You guys see the screen? I will show you. T3162. What is the answer? See, burn involving 60 to 69 percentage of TBSA and a 20 to 29 percentage of third degree. That's all. The answer is correct. That's all, guys. Right? Okay. And one more thing, please note down. I will tell you one guideline, guys. Please note down the guideline. If any condition, the provider mention, the provider mention right, ruled out, ruled out, comma, ruled out, comma, likely, likely, comma, 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 suspected, suspected. right? So if any condition the provider mentioned, the condition is ruled out or suspected or likely, like that anything they document, you don't quote that condition, guys. You don't quote that condition, because those condition is not a confirmed condition, so we are not coded. Clear? So this one also will comes in your exam, guys. If the condition is ruled out or condition is suspected, likely, like that anything they given, please don't quote that condition, because it's not a confirmed one. That's all, guys. So that's all about the ICD. So I'm given the assessment for combination code. You guys, whenever free, you guys derive the answer and send me the answer for that. That's all. So from the ICD and HIPIX, whatever we discuss, these only reflected in the exam. You guys no need to put more effort for this. So daily in your coding, whatever you are following, same thing only reflected, guys. That's all about ICD, guys. Clear? So ICD 5 question and HIPIX 3 question. So totally 8 from this. And after completing all your assessment, you guys will take ICD assessment also. The HIPIX assessment, if possible, today or tomorrow also you guys will do. Clear? That's all, guys. So don't forget. So today or tomorrow I have to share complaints recording. You guys, everyone, please go through that and please don't delete that. Use during your exam. And then still we have only one topic pending. This is for E&M. So this weekend we are completing our session. So if E&M completed mean the entirely will be over. And the candidates hereafter only the main challenge will be started. So who are all planning for your exam, please fix your exam date and start preparing and try to complete all your assessment, right? So today I have to share all the assessment in your group. So please complete all your assessment and practice well. I think in this batch also 2 or 3 already planning for April exam. So guys, prepared well. We need very good percentage from everyone. Clear? That's all, guys. So see you on E&M session, guys. Bye everyone. Good night, guys.